Hi, this is Dr. Mark Trolice again at the Fertility CARE IVF Center in Orlando, Florida. Happy Monday to you all. And today I thought we'd talk about some developments that came out of the recent American Society for Reproductive Medicine meeting in San Antonio, Texas last week. One of the big pieces of news was the discussion about the chromosome analysis of embryos. Okay, so just a little background. Years ago, probably around 2010 or so, we were still doing day 3 biopsy of embryos. And what was that? Removal of some cells, one cell really, usually, on the day 3 embryo, which was only about 6 to 8 cells. Now, since that time, over the last, 5 years or so, we've been doing day 5 biopsy. And on the day 5, that embryo, like this, okay, the outer cells is called the trophectoderm. They're called the trophectoderm, okay? And the embryo is called the inner cell mass. That's going to be the future embryo. Where we biopsy the embryo for chromosome testing, either for gender or for chromosomal abnormalities like Down syndrome, or even single gene defects if the couple are carrier of one disease, or if they're both carriers like cystic fibrosis or sickle cell or hemophilia, Tay-Sachs. We remove the cells, a few cells, 5 to 7 or so, from the outer part of that embryo, which is the future placenta. Now, typically, that's done around day 5 or 6, that's performed. But typically, the tissue is sent off to a specialized laboratory, and then the embryos are frozen. So it requires another cycle for the following month where we thaw the embryo and transfer the one that's unaffected and or normal. So if the chromosomes are normal, or if you did gene testing, we transfer the one that's not affected. Okay? So what's the good of this? Well, the good of this is that you know that you're going to be transferring a chromosomally normal embryo and or an embryo that's not affected by the disease. Carrier state. So what's the good of that? It seems as though you're getting a faster time to pregnancy and a miscarriage rate that's low, about 10% or less. What's the downside? Well, here's where the controversy comes. Sometimes we get information that the embryo is chromosomally abnormal. Okay? So what does that mean? Well, up until recently, we've discarded those embryos, not used them, but it's estimated that at least 20% to 30% may be a normal embryo on the inside, okay, the inner cell mass. So the outer trophectoderm, that future placenta, is what's biopsied, but that may not be reflecting what the inner cell mass future embryo is. So are we discarding embryos that are actually normal, but we don't test the embryo, we just test the outer part, okay? The worry is disrupting the embryo in the inner part of the embryo, okay? The other thing is about mosaicism. Mosaicism is where there's more than one, what's called a cell line, okay? Where you have a percentage of normal cells, but then a few abnormal cells, all in that same embryo. There have been reports that removal of the cells of the future placenta, the trophectoderm, if that came back as a mosaic embryo, there have been reports of embryos transferred, and if there is a live birth, if it didn't miscarry or not get pregnant, if it's a live birth, the embryos have been normal. So this technology is called pre-implantation genetic diagnosis, okay? That typically refers to the single gene testing, like the cystic fibrosis and sickle cell. Pre-implantation genetic screening, or PGS, is usually for the chromosome testing. So right now, it's really getting controversial over whether the PGS is reflecting the embryo, the inner cell mass. And if it's not, should we be doing this right now? And or are we discarding embryos? that are actually normal, but the testing is showing it to be abnormal. So this debate continues, and the information is going on right now where the discussions are, where does this play into our treatment of patients? So we'll definitely be keeping you posted on this information, and we're looking to do this video on a weekly basis. So until next Monday at 4 p.m. Eastern Time, this is Dr. Mark Trolice at Fertility CARE, the IVF Center. Have a great week.